Now we are moving on to the next presenter. Let me invite Dr. Shyjus P is a dedicated gynecologist and infertility specialist known for his expertise in providing comprehensive fertility treatments and gynecological care. He is currently associated with ARMC IVF Fertility Center located in Kannur. He'll be speaking on the topic midlife crisis. Is it real? A warm welcome, doctor. Over to you.
Good morning, ladies and gentlemen. Such a pleasure to be here today at Advances yet another time. Thank you to all the wonderful chairpersons. Thank you, JK sir, Niranjana and Ashwin for the invite. Always a pleasure to be back at Advances. I bring greetings from the Kannur ONG Society, a group of 140 plus very vibrant members doing a lot of good work, not just on the academic front, but on the social front too. A lot of highly scientific and intricate topics, and here I am with this topic on midlife crisis. Some of you might feel out of place, but I would say that barring a few who are probably too young or too old, otherwise you're all here in this phase called midlife. So I'll ensure that you're not feeling out of place. Now the topic for the day is midlife crisis. Is it real? Now there's always this doubt whether it's a overhyped entity or aren't we addressing something which need to be addressed. Now for those of you who don't know what midlife is about, if you define just based on the age factor alone, it is the age group of 40 to 60. But then the definitions are expanding. They feel that midlife is that phase of life where you probably have to manage two generations, one on either side. One, the younger one, represented by your children who would have probably reached their teens or maybe slightly younger or older, depending on what age you got married and you decided to have children. And on the other hand is the geriatric population, represented by your parents and or your in-laws. So when you reach a stage where you are getting sandwiched between two generations, one on either side, I would say welcome to midlife. Now, it is a phase which is actually marked by biological changes, including the onset of age-related physical health problems. Don't just equate this to menopausal changes in a woman. It is very much applicable to a man too. We are talking a lot about the androgen deficiency in an aging male now. I think Dr. Sankar also brought out how much impact it could have on the offspring that you're creating. So, and plus add on to that would be the risk of NCDs, which are not based on the gender factor alone, equally applicable to both the man and the woman. And there are a lot of role transitions that happen. You tend to become a caregiver, especially for your aging parent as well as your aging in-laws. And on the other hand, you have to take care of your children who would have probably become teens by now. So it is probably a tough phase. What is this entity called midlife crisis? The term was coined in the 1960s by the psychoanalyst Elliot Jacks, who thought that some of his patients who were probably reaching their mid to late 30s seemed to go through a very depressive phase as they confronted with this idea of their own mortality. Yeah, the worry about dying one day and vanishing from this world, that was one factor which prompted Jacks to actually coin this term. If you actually look at the incidence as such, frank midlife crisis can probably happen in around 10 to 20% of midlife men and women. But if you include the relatively the minor entities where people are not feeling so good in midlife, then this percentages could significantly increase. Now, if you are in this phase where you are not feeling well and you are suffering from this entity, you may start to regret your career path, some of the choices that you make, and then you feel trapped by some of the financial decisions that you took before. You may also worry about the decline in your physical abilities because you are no more youthful as you used to be once upon a time, and fret about the goals that you have missed out on. Stereotypically, a middle-aged man behaves in a very peculiar manner. He makes some big investments like buying a fancy car, and then in an attempt to regain the sense of youth, he might start dating somebody very young or end his marriage and probably remarry somebody who's very young. And that's the way a man's mind would work when he goes into such a crisis. A woman behaves differently. We will talk a little bit as we go on. Now, in general, how happy or sad are we in midlife? And that would tell you whether it's an overhyped entity or whether it's an under-addressed entity. Now, prevailing wisdom is basically from some of the studies done by the Dartmouth professor Blanchflower. He took data from almost 146 countries, men and women, and he looked at the happiness levels. And he found that the happiness curve was U-shaped. That means both men and women were relatively very happy when they were very young, and they were also very happy when they were very old. And the happiness levels hits the rock bottom when you reach midlife. Now, whether you agree to it or not, we will come to that. And that's why this curve is called the U curve of happiness, because it is U-shaped. Now, do we agree to this or not? Now, if you are a person who's doing very well now in midlife and you're very happy both physically, mentally, and otherwise professionally, then you will not agree to this. But otherwise, you will just think that you're one amongst the many midlife men and women who are not doing so good. Now, the David Blanchflower study was primarily based on the empirical analysis of a range of outcomes, which included points like anxiety, worry, loneliness, sadness, stress, pain, strain, depression, phobias, and panic. These were the entities on which they based their studies. There were other studies which actually looked at more clinically significant mental health outcomes and looked at the levels of happiness. And that was about major depression, mood and panic disorders, alcohol and drug abuse, and intermittent explosive disorders. But fortunately or not, whether you agree to it or not, majority of the studies actually agree to the U curve, that men and women tend to be relatively less happy in midlife when compared to the other phases. Now, is it an age effect or a cohort effect? Age effect would mean that anybody who enters this phase tend to be less happy than otherwise. Cohort effect would be just based on that particular cohort alone. That means if that particular generation was actually reached midlife now, have gone through some very difficult phases. It may be the times when they had to go through the World War times, or the upcoming generation who would have probably gone through the COVID times and all the trouble that actually COVID brought in. And then when they reach midlife, are they more unhappy than the other population? So this is still being debated, whether it is just the age effect alone or the cohort effect of a particular generation. We will require more studies to throw more light on that. Now, is midlife all that bad? Absolutely not. And that is why almost 80 to 90% of men would still remain very happy, because you are probably at the peak of your career. Your earnings too are at your peak, and you are fulfilling multiple roles in life. They say on an average you fulfill almost 5 to 8 roles in midlife, not just the woman but the man too. Now, sometimes you need to actually count this so that you can feel more happy about what you're fulfilling in life. We tend to miss out on these. And you are at present doing all those things that you dreamt of doing when you were young, right? So those are the good things. Now, even when we say there are a lot of good things, it actually brings in a lot of stress. And stressors would come in multiple forms. One important thing is life events. Life events are acute changes that happen in your life that require adjustment within a relatively short period of time. It could be being laid off from your job unexpectedly. Can you just imagine no job in your 40s and you have a family which is financially as well as otherwise dependent on you? It could be a real life-changing event. Or it could be the sudden death of a spouse, your parent, or your child. Now, the impact of such a stressful event depends on the magnitude of that event. It depends on whether you were expecting it to happen or not, as well as the timing. When you're otherwise not doing so well in your mind, no, and then something like this hits you very badly. But if you're otherwise in a relatively good mood and then something like this happens, and probably you were expecting it before that this would happen one day, and then you're more prepared for it, and you tend to take it well. The other is a non-event. Non-event means you are expecting something to happen, but it did not happen. Something like you're planning to marry by 40 and it did not happen. You're planning to have a baby by 40 and then that did not happen. You had some career goals which you wanted to reach by 40. Maybe start your own center and do well professionally, but it did not happen. So those are the non-events. So stress can come in multiple forms. It could be in your relationships. It could be as life events, and it could be as non-events. And all this are definite stressors which have been known and proven to be there in midlife. Now, do men and women behave differently in midlife? Definitely yes. That's why we say men are from Mars and women are from Venus. For women, when they actually go through this phase, they actually go through a period of self-reflection. And if you ever find a woman who's tending to shift away from the needs of others to a state where she's tending for her own needs. You can understand that she's making that change. She's probably going through that change. Okay, a little bit more of self-love, which she did not actually, she could not make it happen earlier, but she's doing it now. She's probably going through this phase and remodeling the entire stuff and making herself comfortable and taking care of her mind. But for the man, he takes it very differently. I told you, some big investments, fancy cars, young woman to date, ending a marriage and looking for a younger partner. That probably is the way in which a man behaves. So the genders behave very, very differently. Now, what are the signs of midlife crisis, which is something that we all need to know? Okay. One is deep sadness and regret. It could be about missed opportunities at job or your relationship. Restlessness. You find somebody, a colleague who's totally bored of her work. Okay. That could be the one who's actually going through this phase. Daydreaming about how life could have been if I had made some other choices. I know a lot of us do daydream. Doesn't mean that you're, just because of that factor, you're in midlife crisis. There's an irritability about the past decisions that you have taken, which have actually cut off your wings and have boxed you. Nostalgia is about reminiscing the past on how good you were once upon a time. Impulsive or indulsive behavior, making big purchases, as I already told, and indulging in habits like overeating. As they say, when you're not doing well with your mind, then you tend to overeat and you gain weight. Change in sexual desire, dating somebody who's much more younger, and changes in ambition. Now, if you find people with one or more of these, then kindly note that because they could be the ones who could be suffering within. Now, how to overcome this? Now, if they have major issues, something like major depression because of what life has thrown on them or life is throwing at them, at him or her at this point of time, then definitely it requires the help of a trained, a very knowledgeable mental health professional. But then if problems are minor, then you can probably help yourself by listening to such lectures. Some pep-up talks can really help. Or a more sorted person, a person who's more sorted than you, who has actually gone through this phase and has taken it well and understood the intricacies involved and have managed it well, that person can actually help you. There is a role for pharmacotherapy when the problem is clinically very significant, and some of the most common prescribed antidepressants that are used are SSRIs and SNRIs. And then there are other treatments, including anti-anxiety medications, which are prescribed for men and women who have significant mental health problem. But something which is a very underutilized modality is something called psychotherapy or talk therapy. Now, this is very different from the counseling, which was a word which you used to hear. Counseling is primarily about the counselor talking more. Okay, this talk therapy or psychotherapy is first understanding what is the status of that particular patient, trying to understand the immediate surroundings of that particular person who's sitting right in front of you, and help him or her to give us the solutions. So it is the patient who actually does everything. You are just helping her to sort out the surroundings and to find out a solution. So it will be a very custom-made kind of a plan, and it works very well. Otherwise, most of the counseling sessions, what happens is you will tell all the signs you know, and then ultimately it is not, the patient is unable to practice it in her surroundings, right? Because we know that people come from all different social strata, and the immediate surroundings for every particular person, that micro environment is very different from one another. So the common theories might not really work well there. So talk therapy is something that we need to utilize more. Now, if you have some minor problems, then such pep-up advices can really, really help you. One is very important thing is to accept the change, because what we know that the only constant thing is the world is that the world keeps changing, right? So change is very inevitable as you age, and you need to make peace, and that is too vital. Acknowledge your feelings. If you're not feeling very well, no, don't push it under the carpet or don't try to ignore it. You need to acknowledge that particular fact that you're not feeling well, and that actually helps rather than pushing it under the carpet. Identify and accept circumstances that are beyond your control, and don't get into a battle. That really helps. And if there's a new job or a new place that you have to fit into, you need to slowly ease into those new situations rather than making some radical changes and trying to fit in there, because that might make it very difficult. Tip number 2 is to maintain a sense of purpose. Try out something new. Engage in old interest. It could be with music or dance or modeling or whatever interest you had laterally. This is the time to explore, and that really helps to actually tackle the problems of midlife. Embracing community activities, giving back to the society is probably one of the best way. You'll feel very good before you actually go to sleep, because if you were able to bring in a little bit more, a few more smiles in certain other people, you contribute a little bit more to the society. So getting involved in all these kind of activities really can help. Tip number 3 is to prioritize self-care. I told you women do it very naturally, men tend to learn it very later. So just place yourself first whenever you are in trouble, because that helps you sort out your problems and you are in a much better position to take care of your family too. So midlife will likely bring in changes to your body, to your sleep habits and your relationship with food. Set very realistic exercise goals. Don't do too much of workout and kill yourself. Very important. But more important than would be, do not decide not to do workout and then again kill yourself. Okay, so be very active, but don't overstress yourself, because exercise is too important when it comes to midlife. Reassess your diet, make some very realistic plans. Practice this entity called mindful eating. It's slow eating by understanding and appreciating the food item that is there right in front of you. Get enough sleep, a minimum of 6 hours, 7 to 8 would be ideal. I know that most of us are struggling to get that much of sleep. Ensure that there is good amount of coziness and a good environment to sleep. We call it by the name sleep hygiene these days. Okay, keeping away from your mobile gadgets at least 1 hour before you go to sleep. Avoiding some stimulant drinks like tea or coffee before you go to sleep. Having a perfect lighting, a very cozy atmosphere, good bed sheets, pillow covers. The curtains in your bedroom need to be well maintained. Choose the colors well so that you create a cozy environment. And that's the entire entity is called sleep hygiene, which actually helps you to get good sleep. The other tip would be to adjust your perception about midlife. Practice gratitude. As I always say, what is a normal boring day for you could be a dream for somebody else who wanted to achieve that much. So always make it a habit that you look at your accomplishments. Many times we don't do that, right? Ask yourself, how much have I grown? Okay, not just at the level of the belly, but I'm talking about the mental growth. Reframe this word called setback, because that is something which everybody tells you. This person, I was doing well, and this person created a problem in my working environment, and I got pushed out of that place, and then I could never grow and all that. So just reframe that word called setback to opportunities for growth, and then you're probably doing well. Now, how can you help somebody else to navigate this phase? I think the world is filled up with people who give advices, but we really miss a good listener, right? So if you want to help somebody who's going through a tough phase in midlife, be a non-judgmental listener. It could be your partner itself. It could be a friend or a colleague. It could be anybody. It could be anybody who's even younger or older than you. But just be a very good listener. Be receptive to the potential changes that can happen in your own relationship. Keep an eye for the signs of depression. Okay, in everybody around you who's going through midlife, if you spot them well, no, you could be actually doing a really good thing. And spending more time together with your partner can really help with the kind of changes that can happen in the relationship, and expressing appreciation for even the little things that he or she does for you in a relationship. The other important thing before I finish is this entity called internal critic. Internal critic is the one, when we were young, no? This internal critic was the perfectionist within us. It wanted us to dream more and achieve really big things in life. But when you reach midlife, no, the same internal critic becomes the recipe for suffering. Because in midlife, if your internal critic wakes up, it will start comparing your achievements with your colleagues. Okay, so in midlife, if you want to be happy, put this internal critic to sleep. You really don't have to be better than anybody else. You just have to be better than what you were yesterday. And that much is good enough. Okay, so that's how you put your internal critic to sleep, and then you are on the way to leading a very happy life. Does money matter in midlife? The sentence from the Forbes magazine that always remember that money is not everything in life. How many of you agree to that? Yeah. But the most important thing is, I would tell you that money is not everything in life, but make sure that you earn sufficient before you think of such nonsense. Because there are good enough studies on midlife happiness that I've talked about this particular point that being rich is one of the ways to actually remain happy. It's not about being filthy rich. It's about being rich enough to have enough money to take care of yourself, to take care of your family, to ensure that there is some fund kept for you to live your passion. If you love traveling, there's money to travel, those kind of stuff. Having a health and a life insurance for you and your family matters. Professional protection schemes if you are a health caregiver. Being healthy is so, so very important. And having some solid social networks, okay, with people across professions, not just a doctor group alone, okay. Because if there is a trouble in your life, you can actually seek their help and they'll help you out. On that note, thank you so much for a very patient listening. It's been a pleasure to be here today.
Thank you, Doctor. Thank you so much for such an interactive session.